Hi, I'm Ashley, Senior Clinical Advisor at Carepatron, and I'm here to help guide you through the hearing test battery assessment. What is a hearing test battery? The hearing test battery comprises of 3 hearing tests: the whisper test, the Weber test, and the Rene test. These tests help healthcare professionals assess the hearing of patients who have or may have ear problems. All 3 or just one test may be performed and can be part of a comprehensive examination like the HEENT assessment and nurse neurological assessment. When conducted as a battery, the healthcare professional will start with the whisper test. For this test, the professional conducting it will stand at least 2 feet away from the patient, and they'll whisper a sequence of numbers and letters to them from that distance. The patient will then try to recite the sequence in the same order. If they don't pass this test, the professional will move on to the other 2. The Weber and Rene tests, on the other hand, both test for the degree of deafness that the patient has using a tuning fork. As a result, it is commonly used by audiologists. Here's how to use a hearing test battery assessment. The first step is to fill in the name and date, gather the materials, and start with the whisper test. You'll then need to move on to the Weber test. The final step is to conduct the Rene test. Remember to read the instructions and record the results. To view a sample assessment of the hearing test battery, head on over to carepatron.com where you can download and access the assessment for free. You can also access the assessment through the Carepatron community platform. Type in the keywords and edit the note however you would like. Thanks for watching, and remember to subscribe to Carepatron to view more healthcare related videos.